It's 2 a.m. Margaret, 67, wakes up with a dull ache in her chest. She brushes it off as indigestion from dinner. 20 minutes later, the pressure intensifies. Her left arm feels heavy. A cold sweat breaks across her forehead. Her husband passed away 3 years ago. Her daughter lives 2 states away. Her phone is charging in the kitchen, 10 steps that suddenly feel like a mile. She's alone, and she's having a heart attack. This isn't a dramatic movie scene. This happens to thousands of older adults every single day. And here's what most people don't realize. After age 60, your chances of surviving a heart attack alone drop significantly if you don't know exactly what to do in those critical first minutes. The decisions you make when you're by yourself, confused, and scared can mean the difference between recovery and tragedy. Every year, over 800,000 Americans experience a heart attack. Nearly half of them are over 65. And cardiologists warn that a growing number of these seniors live alone or find themselves alone when symptoms strike. Here's why this matters more as we age. After 60, our heart tissue doesn't bounce back the way it used to. Our arteries have decades of wear. Many of us take multiple medications. We might have diabetes, high blood pressure, or previous heart issues. Our bodies simply don't handle cardiac emergencies with the same resilience as younger hearts. But there's something even more dangerous than the physical changes happening in your body. It's the isolation factor. When you're alone during a heart attack, there's no one to call 911 for you. No one to unlock the door for paramedics. No one to tell doctors about your medications or medical history if you lose consciousness. Emergency room physicians see this pattern repeatedly. Older adults who waited too long to act because they didn't want to bother anyone or because they weren't sure it was serious enough. By the time they get help, precious heart muscle has been damaged. Some never make it to the hospital at all. But let's talk about what actually happens during a heart attack, because understanding this can save your life. A heart attack occurs when blood flow to part of your heart gets blocked, usually by a buildup of plaque in your coronary arteries. Without oxygen-rich blood, that section of heart muscle starts to die. Every minute counts. Brain cells can survive without oxygen for about 4 to 6 minutes. But heart muscle? It starts suffering permanent damage within 20 to 40 minutes of blocked blood flow. This is where many people get it wrong. They expect heart attacks to feel like they do in the movies, sudden, crushing chest pain that drops you to your knees. But especially in older adults, and particularly in women over 60, heart attacks can be subtle. You might feel unusual fatigue, shortness of breath, nausea, jaw pain, back discomfort. That vague pressure in your chest that feels more like a heavy weight than sharp pain. Your body is trying to tell you something is desperately wrong, but the signals aren't always obvious. Now, here are the 7 life-saving tips that every senior must know if you're having a heart attack while alone. Tip number 1. Call 911 immediately. I cannot stress this enough. Even if you're not completely sure it's a heart attack, call 911. Paramedics can start treatment in the ambulance. They can notify the hospital so the cardiac team is ready when you arrive. They have equipment to restart your heart if needed. Your neighbor, no matter how caring, doesn't have these resources. Every minute you delay calling for professional help, more heart muscle dies. Tip number 2. Unlock door. If you lose consciousness, paramedics need to reach you fast. They shouldn't waste precious minutes breaking down your door. After you've called 911 and while you're still able to move, unlock your front door. If you have a security system, disarm it. Then get to a safe position near the entrance where you'll be easily found. Tip number 3. Chew aspirin. What most older adults aren't told is that aspirin can be life-saving during a heart attack. It helps prevent blood clots from getting bigger. Chew it. Don't swallow it whole, because chewing gets it into your bloodstream faster. This is typically a 325 milligram regular aspirin, not a low dose or coated one. But only do this if you're not allergic to aspirin and haven't been told by your doctor to avoid it. Tip number 4. Sit or lie down. Don't try to drive yourself to the hospital. Don't do housework while waiting. Don't convince yourself to walk it off. Sit down or lie down with your head and shoulders elevated. This reduces the work your heart has to do and can help you stay conscious longer. Tip number 5. Stay calm. Panic increases your heart rate and blood pressure, making your heart work harder when it's already struggling. I know this sounds impossible when you're terrified and alone, but try to take slow, deep breaths. Count to 4 as you breathe in. Hold for 2, breathe out for 4. This simple technique can help regulate your heart rate and keep you conscious. Tip number 6. Don't cough. You may have seen social media posts claiming you can save yourself during a heart attack by coughing forcefully. Medical organizations, including the American Heart Association, have debunked this dangerous myth. Cough CPR doesn't work for actual heart attacks and wastes time you should be spending getting real help. Tip number 7. Keep info accessible. Before an emergency happens, prepare. Keep a list of your medications, allergies, and emergency contacts on your refrigerator or in a clearly labeled spot. Wear a medical alert bracelet if you have heart disease. Program ICE. In case of emergency, contacts into your phone. These simple steps help first responders treat you properly, even if you can't communicate. Let me be clear about what happens if these steps aren't followed. When seniors delay calling 911 during a heart attack, survival rates drop dramatically. Studies show that patients who arrive at the hospital within 90 minutes of symptom onset have significantly better outcomes. After that window closes, the damage multiplies. Even if you survive a delayed heart attack, the consequences can be severe. Permanent heart damage means you might need stronger medications for the rest of your life. You might develop heart failure, where your heart can't pump blood effectively anymore. You could face chronic fatigue, severe limitations on physical activity, or the need for devices like pacemakers or defibrillators. Some people lose their independence entirely, unable to live alone safely anymore, requiring assisted living or full-time care. This isn't meant to frighten you. It's meant to show you why those first critical minutes matter so much. Now, surviving a heart attack is one thing, but reducing your risk in the first place, that's where real power lies. Cardiologists emphasize that many heart attacks in seniors are preventable. It starts with knowing your numbers. Get your blood pressure, cholesterol, and blood sugar checked regularly. These silent factors build up for years before they cause a crisis. Stay active within your ability. You don't need to run marathons. A 30-minute walk most days of the week strengthens your heart and improves circulation. Talk to your doctor about what's safe for your specific situation. Manage stress. Chronic stress raises blood pressure and contributes to heart disease. Whether it's gentle yoga, meditation, time with friends, or a hobby you love, find healthy ways to decompress. If you smoke, quitting is the single best thing you can do for your heart at any age. Even if you've smoked for decades, your heart starts benefiting within weeks of quitting. Eat more whole foods, fruits, vegetables, whole grains, lean proteins, healthy fats. Limit processed foods, excess salt, and added sugars. Small, consistent changes in your diet make a real difference over time. And perhaps most importantly, never ignore warning signs. If you experience new or worsening chest discomfort, unusual shortness of breath, unexplained fatigue, or any symptoms that concern you, talk to your healthcare provider. It's always better to get checked out and be told everything's fine than to ignore something serious. Here's what I want you to take away from this video. Knowledge is your greatest ally. You now know the real warning signs of a heart attack. You have 7 specific, actionable tips that could genuinely save your life or the life of someone you love. But awareness only works if you act on it. Have that conversation with your doctor about your heart health. Prepare your home for emergencies. Share this information with other seniors in your life who live alone. Your heart has been beating for you every second of every day for over 60 years. It deserves your attention and care. If you found this video helpful, please hit that like button. Subscribe to our channel for more essential health awareness content created specifically for seniors and their families. And drop a comment below. Do you live alone, or do you know someone who does? Remember, stay aware, stay prepared, stay healthy,